Hello, this is Dr. Grande. Today the question is, what is purely obsessional OCD? This is also referred to as pure O. And it has a lot of other names, including primarily cognitive OCD, OCD with covert compulsions, and primarily obsessional OCD. But all these terms are referring to the same construct. It's not a mental health disorder, but rather a particular presentation we sometimes see with obsessive compulsive disorder. Now the name pure O is a bit misleading, but I'll get to that in a few moments. First, let's take a look at what this term refers to. So with obsessive compulsive disorder, we usually think of this disorder as having both obsessions and compulsions. In rare instances, it can have only obsessions or only compulsions. Now the term pure O is not referring to a presentation of OCD that only has obsessions, but rather a presentation of OCD that has obsessions and what we call covert compulsions. So obsessions are thoughts, images, and impulses that are disturbing, intrusive, and unwanted. And compulsions are behaviors that occur to neutralize those obsessions. Usually we think of compulsions as overt, like checking a doorknob or hand washing or some type of ritual that's observable to other people. But compulsions can also be covert. They can be cognitive. And that's what we see with pure O. We see obsessions, and in response to those obsessions, we see cognitive compulsions, covert compulsions. So typically when we think of OCD, we think of the obsessions as pushing people to check, count, or perform some type of ritual, like keeping things symmetrical. With pure O, the obsessions have a different type of characteristic. They are oftentimes violent, sexual, offensive, or evil types of thoughts, images, and impulses. So to give some examples, from the violent obsession type, somebody could be standing next to somebody on a subway platform, and they could have this image or impulse that they want to push the individual onto the tracks. Or they could be sitting at a kitchen table and there could be a knife there, and they could have this impulse to stab the other person. Now the vast majority of the time, of course, the individual is not going to act on these type of impulses, but the intrusive thought itself is disturbing. It causes anxiety and fear. Now in terms of sexual obsessions, these take on a wide variety of forms. So one example could be where an individual is fantasizing about having sex with somebody when they're not attracted to them, or when it would be inappropriate, illegal, or against society's norms to have sex with that person. For example, if somebody's fantasizing about having sex with their brother or sister. Now sometimes these sexual obsessions are fantasies about having sex with somebody that a person is attracted to, but oftentimes the individual is not attracted to the other person. Now, we also see verbally aggressive and offensive obsessions. So these are similar to the violent obsessions in the sense that an individual is thinking about saying something to somebody that would be almost certainly construed as verbally aggressive or offensive, like to cause a fight. Another common type of obsession we see with pure O are obsessions that have to do with a person being evil or sinful. And oftentimes these are in response to the violent or sexual obsessions. The individual does not want to engage in those obsessions, so those thoughts and images and impulses are contrary to that individual's belief system. So that's where we get this sense of evil or having committed a sin. So when we talk about primarily cognitive OCD or pure O, and we talk about these compulsions, we're really talking about hidden compulsions. Individuals are thinking thoughts to themselves to neutralize or counteract these violent, sexual, or otherwise disturbing and distressing obsessions. So there are compulsions occurring, just not the compulsions that we normally expect with OCD, which would be observable. I mentioned earlier that the term pure O is misleading. I prefer the term primarily cognitive OCD. The reason the term pure O is misleading is because there is a type of OCD that only has obsessions, but that's not what pure O is referring to. So somebody could hear the term pure O and not only fail to understand what it's about, but believe it's about something entirely different. Now, when it comes to terms that refer to mental health symptoms, pure O isn't the only incorrect term, but sometimes these terms make a lot of sense, and I divide these terms into three categories. Consider a mental health disorder like generalized anxiety disorder. Even if you don't know anything about generalized anxiety disorder, the term itself tells you something helpful. Then we have the next category, which would be a term that doesn't really give you any information, like borderline personality disorder. You really can't tell what that personality disorder is about from the term borderline. Pure O is in that third category, where it's not just neutral, but rather it's misleading. And I think it really should be replaced by something like primarily cognitive OCD or some other term that gives an idea to an individual about what the term is referring to, what the characteristics are of the disorder, rather than leading that person in a whole other direction that really doesn't have anything to do with the symptoms. I believe that this particular presentation of OCD warrants further research, but it is important to recognize it's not a distinct classification, and just because somebody has those types of symptoms doesn't mean they don't have counting and checking and other rituals associated with overt compulsions. I hope you found this description of purely obsessional or primarily cognitive OCD to be interesting. Thanks for watching.